Make no mistake, this bill is not about protecting women or saving lives. We understand the strategies at play here. This is a whittling away at abortion access for women. Telemedicine uses webcams and other electronic technology to connect doctors with other medical personnel and the patient at remote locations. It has been used for years to bring specialist health care to people who live in remote areas and who do not have access to a provider. As of 2008, 95% of Minnesota counties had no abortion provider. 62% of Minnesota women live in these counties. The intention of this bill is clear. It creates an unnecessary barrier for women who do not live in areas where an abortion provider practices. Women will have to travel hundreds of miles, which is not in her best interest or safety, to access a medical procedure that is her constitutionally protected right. This adds to the cost of abortion care, particularly for rural women and many low to moderate income women who cannot afford the additional travel costs, time off of work, and it continues to create disparities in access between those who can and cannot afford safe and legal abortion services.
I think no matter where you are in the pro-life industry or pro-choice, this is a liability to anybody who's standing in the room without a doctor present. And I just have huge concerns. Like I said, set aside my pro-life stance, but I have huge concerns as a registered nurse on the liability that this is creating when the doctor's not there, when they're talking over a TV, and then treatment is being administered. And this drug does not come without some grave side effects.
I think this bill is in very many ways similar to the previous bill. It's focused on, because we're dealing with abortion, we want to put extra burdens, extra problems in the way. And if it is, because there are risks for taking a medication like this, that we've got to make sure the physician is present. I see that the risk of associated death from mifepristone, RU-486, easier to say, 1 out of 100,000 prescriptions. Viagra, it's 5 out of 100,000. I want to hear somebody come here and suggest we ought to have physician presence required when Viagra is administered. But that's the whole point. I mean, we're taking one thing and we're deciding because it has abortion related to it, we're going to make sure a physician is present. We're going to make sure we deal with the clinics and have some more licensing standards and everything else. No other physician clinic is going to have that, just these ones. No other drug, even ones that are maybe 5 times as risky for death or other things. We're not going to have physicians required for them, but for this one, yeah.